Hello. We will start today's program with an interview with Jackie Powell, Chair, and Margaret Forbes, Executive Director of Connections Place. Connections Place, promoting mental wellness in Greater Victoria, a place for people with mental health challenges to gain confidence, respect, hope, and opportunity. And they also offer unique programs, which we will get more information from them. Connection Place is doing a tremendous job in the Greater Victoria, and especially in pandemic, has a great effect on the mental health as well. So today, we will be talking to Jackie and Margaret to see how Connection Place is doing in pandemic. So welcome, Jackie and Margaret.
Thank you very much for having us on today, Seema. Really appreciate it. So I'll just first give you a little background about Connections Place and how it began. So it was in 2014, I discovered the program that's called Clubhouse International. And I went to the training in Fort Wayne, Indiana, along with several other parents in the area. And I also visited the clubhouse, the original clubhouse, Fountain House in New York City. And I was just amazed and knew 100% this is definitely what's missing in our city. And what is missing in our city is an opportunity for people to gather in a safe environment with peers and a small staff to get back on their feet. I witnessed firsthand, I should say, get back on their feet after or during a mental health crisis. So I've witnessed firsthand what happens when someone, as my son, who was very sick, and you lose all your friends to begin with. Many people do, and their family, their job, and they're just left to their own devices if they don't have the support. And so when I saw this program, I just knew this is what was needed to get people back on track, especially if they didn't have that support. It's all encompassing. It covers social, it covers, the relationships, of course, which is social, education, employment, you name it. It's everything under one roof. And a full clubhouse has housing too. They provide opportunities for housing. So that's in a nutshell. I mean, we can talk about it more as we go along. So I started a nonprofit and a charity, a board. You need all these formal things in place in order for this to happen. So we opened our doors just shy of 3 years ago. And here we are today, and we have Margaret, our executive director, who I'm going to introduce to you now. We're so proud and pleased to have Margaret on board. She has so much experience, and we're just really pleased to have Margaret here at the helm. So over to you, Margaret.
Thank you, Jackie. And I'm thrilled to be part of Connections Place. I'm new to the program and just so inspired and in awe by everything that's been accomplished by Jackie, Connections Place Society, and the board. There has been so much accomplished. We have this gorgeous space that I am able to work in and meet people in, and it's been very exciting for me.
So tell us a little bit about yourself, your background, Margaret.
Sure. I have worked in mental health for a very long time. I moved from Ontario about 10 years ago. And prior to that, I was working in pretty intensive case management. I worked in a court diversion program with people with mental illness. So I was meeting them in the jail, in the courthouse, getting calls from families, and really helping to, in a voluntary program, helping to stop that cycle that often happens. Often the criminal justice system is a first contact for people living with serious mental illness. Their symptoms disrupt the community, and they end up with police contact. And so this program was stopped. That I moved to BC about 10 years ago. During that time that I was working in that program and moved to BC, I finished a master's in public administration and policy. So I'm really interested in both helping people, but also working within systems and changing the systems so they're easily accessible for people. Okay. I found it a real exercise in futility and frustration for me, working with people and trying to help them navigate a system that just wasn't set up to receive them. So that motivated me. So that's me.
That's good. So tell us about Connection Place. Like, what exactly? I know it's been going on for last 2-3 years, but which is, I'm sure the people who are in Victoria, they're quite aware of it. But some other audience who may not know about Connection Place.
Well,
sure.
Yeah, not many do know about it yet.
Yeah, and we're trying to spread the good word, because I think it really is important to share. So Connections Place, even though it's the best kept secret in town, has 235 members. So we have a membership of 235 people who live day to day with serious mental illness that's persistent, and our members. And Connections Place is set up like a drop-in for members, so they can come as they need us. And a membership is free. It's like a one-page application. We really just want some safety information. So if somebody is in crisis, we can contact supports for them. That's really the major reason for the membership, is just so that we can reach out if we're concerned. They're a member for life. They can, their only criteria for membership is that they're living with mental illness and looking to be part of a wellness journey. That's really or just wanting a space where they can experience their symptoms and not feel uncomfortable, because they know that it's just everybody's living through it.
Yeah. So do they need any requisition from any physician or?
So we do have a really quick form that just says the primary diagnosis is mental illness, that vouches for the individual. I do know, like that is certainly, if that was a barrier for somebody, though, we would look at other ways of validating that. It's more so that it's a space where, as one fellow said the other day, he was new and he asked some other members, this is a place where I can talk about my mental illness, right? Like that's kind of, like it really is a safe place to share and to be able to talk and to develop relationships that are meaningful in their lives.
Mm-hmm. Yeah. So what are the hours? Are you guys open now Monday to Friday? I know before was Monday to Thursday.
Yes, very exciting. We have, because of the loosening of the public health orders to allowing indoor gatherings, we were in a kind of a modified program for most of the pandemic, whether that was Zoom outreach and then later scheduled drop-ins. So 10 people could come in the morning and 10 people could come in the afternoon, and we had 2 lunch shifts and things. And we've now moved to full drop-in. So people don't have to call ahead, they can just come, and our meal program has moved to a proper lunchtime and just 1 meal program. So that's pretty exciting. 9 to 3:30. We have some amazing staff who work for the program, but we're strategically understaffed because we really encourage the members to take ownership for the program. So everybody pitches in with the tasks that need to be done, whether that's serving coffee. We have like a kind of a cafe set up where there's a hot meal, and it's all really affordable. We subsidize it, so it's only $2 for lunch and 50 cents for coffee, and people can help out with that and do the dishes after and sweep the floor. So we all kind of pitch in. with that. And we staff arrive at 9 o'clock, and at 3:30 the doors close, and it's meant to be more collegial than clinical in as far as programming goes. It's meant to be, we work together. We collaborate together on ideas, and we build the program together and support its operation together.
So is it Monday to Friday then?
Monday to Friday, yes.
Mm-hmm.
And we do one evening a month, we have a movie night, and we'd love to do more of that as we grow, more kind of wellness activities or social gatherings. But yes.
So how many, I know you said understaffed, so how many staff do you?
So we have a part-time staff who helps with, who prepares the meals, and then 2 staff who support operations, and then myself. And I'm my primary role, although I love being in the clubhouse and participating in the various things going on and conversing with members. Mine is finding the money, donations and grant writing and things. So
yeah. So
and then we also, I don't want to forget, we have partnered with Umbrella Society to support people who have co-occurring disorders, so addiction and addiction, substance use, or mental illness, who are coming out of hospital. And we have a peer support team that is a staff from Connections Place and a staff from Umbrella Society that meet people and connect with them as they transition out of hospital and are making plans to connect with services.
So
yes,
I think, yeah.
Well, I was just going to say, I've spoke to Clubhouse International, and they told me that they're it's between 30 and 40% of the members worldwide, because we're one of 330 clubhouses worldwide. So it's estimated that 35 to 40% of the membership worldwide has an addiction in addition to mental illness.
Yeah, and that's very common. People self-medicate, right? Something's not right, whether it's anxiety, whether it's, a mania or depression, and people are trying to find wellness. And often substance use is part of that journey of trying to make it feel better. It unfortunately often makes the situation worse, but it's a common concern.
Yeah, so that's what's great about our program, because people are welcome to come if they're in active addiction. However, they can't be using or be of any danger to themselves or others while they're there. So the hope is that we're an alternative to going home and using a substance or gambling or doing whatever it is that the person does. Just coming and being in a healthy environment with like-minded people who want to be well.
Yeah.
So that's...
Yeah, it's a recovery journey and a recovery conversation that is part of what makes the space safe. So people know they can come meet with peers, and their peers, there won't be drug use there. There won't be that temptation, which often they're trying to avoid when they're coming to us. Definitely. Or if someone is recovering, it's a safe place to go.
Yeah, definitely. I totally agree. So how many members do you think you get like on a regular basis, like a daily? What do you think?
Yeah, well, it's interesting because before we could get up to 20. Now we are getting, at this point, it's hard to say because we've only opened up since December 1st, but we were able to host we started a book club, and it has 11 members. And so we were able to, everyone was able to sit masked, of course, in a circle, and other members were doing some art activity and things who didn't participate in it. So we're able to create more programming, which draws people in. So I'm hoping that it'll be around 30 members a day. I think that's fairly realistic. So not everybody, some people just pop in and pop out. Some people, it's just their structure to their day. They just like to come in the morning and knit and then leave in the afternoon, and that just helps them get out of the house and socialize a bit. So it really, our members use the space for different reasons.
Mm-hmm.
So I don't know that we've really talked about the work order day. So a large part of what goes on in the clubhouse is based on what they call the work order day. And so it's all the jobs that need to be done in the clubhouse are done by members and staff. So they'll have a meeting in the morning. I don't know if you want to talk about that, Margaret.
Yeah, for sure. I actually have some slides that I was thinking I could show while I'm, if you don't mind, Seema, and then I can kind of talk through them for the radio
definitely.
listeners.
Sure. So just let's see.
Perfect. Yeah. So as I described, we're like a number of things. We're a drop-in space where people can hang out and play a game. We're an employment program. We're a place to express creativity. We're a cafe space, but it all is centered around a work order day. And what that means is just like all adults, we all need that structure in our lives in order to, and certainly it's been proven and over again that this kind of model of structure and feeling a part of something and a part of something bigger, right, than themselves and their mental health journey is really effective in helping people through to wellness. And the work order day, what it is that we have 4 units within the within Connections Place that are work or jobs that need to get done. And they're the kitchen, the meals got to get cooked, the dishes have got to get washed, just like any other place. We have a maintenance unit, bathrooms have got to get cleaned, floors have got to get swept, garbage has got to get taken out. That needs to happen. We have a support unit, like an outreach unit. Our members need to get touched by us. They need, if we haven't seen them in a while, we give them a call and say hi, like we really miss you and we'd love to see you again. Our members do that as well as our staff. So someone volunteers to do each of the jobs that needs to get done in the day. We have a morning meeting where we have some decisions that need to be made in the program, whether it's, we've had it back to drop in. One of the decisions was, do we want to include a walk? Do members want an excuse to go for a walk after lunch? And do you want some help facilitating that? So that was a decision that was made today. We also have events and things that are happening, and we have jobs that are assigned. So someone goes to the board and they write down the volunteers' names to the jobs that need to be done. And we have a big whiteboard with all the tasks in that need to be done. We have a database that our members log their hours worked and their hours in the space, and it's all voluntary. So members can, if someone's not feeling well, they don't have to participate in the meeting, and no one asks them to. It's all kind of there if they need it and want to participate in it. We also have some opportunities for members to contribute ideas and suggestions. So that's the work order day. And then we all do our work, and then we connect for a meal, and then we have another meeting just to kind of reset and where, other jobs need to be done. And then we usually have some sort of wellness activity, and that could be, I've got so these are some members working in the work units, but as you can see, we have like a wonderful community kitchen that is a hive of activity. We have members on reception that's their job, and we also have here's our meals. creative activities, an amazing music circle. I am thrilled that I get to be part of it and play my guitar, which is mostly collecting dust, and sing along with people. Like, it's just a really vibrant space. Creativity, some members approached me and said they'd always wanted to be in a book club. So we started a book club and went to the library. They selected the book they wanted to read. I got a book set out of the library and we're all reading it. And it's not, so it's very much opportunities for leadership, opportunities to take risks, opportunities to try new things. And we also have some employment supports that we're building out.
Yeah, I was going to talk about transitional employment. We haven't, unfortunately, got that off its feet yet. A lot of it's been due to COVID, of course. But a big part of what the Clubhouse International program is about is transitional employment. It's very unique to the Clubhouse program. And that means that staff and members will liaise with companies, businesses in our community and find work, part-time work, entry-level type jobs. It could be working in a hardware store, helping to do some, what do you call it when you put stuff on shelving? Stocking shelf, or washing a car down the road at the say Nissan or Ford or wherever. Working in McDonald's. It could be any entry-level job. And,
we have some members with some real talents for things too. Like, we had a member who's starting a motivational speaking company, and he presented yesterday an amazing presentation, and is kind of taking the show on the road. So I think, like, there was just people came with people come to their mental health journey with all kinds of life experiences.
Exactly.
They might have been, doing really well until 40, and then, experienced a manic episode and found out they have bipolar disorder, and now they have to regroup and figure out what to do. So,
right.
For some people, it is early in their life, the symptoms, and that interrupts their education and their jobs, and they may need those entry-level skills, whereas others, it's kind of just getting strong again and being able to get back to society, like back into society. So the one thing I'd like to share is the evidence around this. So this is a model that's been around since 1948, and the impact on people's lives who become members is enormous. It's well researched. There's been lots of psychiatric journals that have published research on the Clubhouse model. There's been studies about the social return on investment. So this Clubhouse model, it prevents recidivism from, that repeat in the criminal justice system that I talked about earlier. It decreases significantly hospitalization. The longer someone is part of a clubhouse, it decreases by almost 50%. They're going back into hospital. So that's an enormous savings, both to the people who are experiencing crisis that land them in hospital, which is really difficult for everybody, but also it really saves some healthcare dollars. And the other thing it does is it moves people into employment. And the other important things are the softer things it does, like it improves people's quality of life. That's been proven. People who were part of a clubhouse were able to say that they had one relationship in their life that they could reach out to, that they knew was a support to them. And that's not true of other, consistently with other mental health programs. So there's some enormous benefits to this model that I think was well chosen for Victoria.
What I really like is that during COVID, one of the creative things that would happen was one member started up a bike club. Mm-hmm. Yeah. So that's ongoing. It continues today with members. So it's that's what it's all about with the Clubhouse model. It's just it's creativity. It lets people think and use their head and get out of their apartment or wherever they're living.
Mm-hmm.
So one of our members pre-COVID, he's a very talented man with several degrees, and he was teaching ESL, English as a second language. And that was really neat. So that's what Clubhouse does. And he was helping many people, several people, I should say, improve their English. And that's what you'll see in a Clubhouse. You'll see on a shelf tutoring math at 2 o'clock with Joe, that kind of thing.
Yeah, we have an author.
People,
Yeah.
as Margaret was saying, of all walks of life. It could be a pilot, it could be a lawyer, it could be a doctor, and they bring their talents and they share with others. But then again, for the people who need the entry level, that's what we're working on to do, so they can build up their resume if they've got a big gap in their resume, for example, and we would help with the resume and do job interview skills with them, have mock interviews, that kind of thing, and also support them in that job too. If they can't go one day because they have a problem with their health, then a staff person from the Clubhouse would go and fill in that job. It's guaranteed to be filled. So, but that, as I said, because of COVID, it hasn't happened. But
well, it's happened to some degree, but it's going to be more full, I would say, in the next year. That's now our focus to really to build on that. And we've got a few things in the works. We'll come back to share with you once they're up and running. But it is it's quite a magical place. I would encourage people to take a tour or to come by and give us a call and get more details for sure.
So why don't you share your email, your phone number, and what's your address? Where are you located?
Yeah, so we're not far from Uptown Mall at 3375 Oak Street in Victoria, and our phone number is 250-483-3748. And you can reach us as well by email at info@connectionsplace.org. And some ways that people can get involved beyond getting a tour. Anyone, as I said, membership is really easy. You just have to be living with mental illness and want to connect with us, and that's really it's a very quick application. You can do it on our website. You can do it in person, and we can support you through that. So people could be a Connections Place member. We're always welcome to donations. So, people are always welcome to donate to us. We make it easy. We have a donation button on our website, connectionsplace.org. And we certainly appreciate that support to help people with wellness. And I know many people in this community are very generous and have supported us over the years, and we welcome and encourage donation. If people really want to be part of this amazing group that has accomplished so much to support people with mental wellness, they can also be a member of Connections Place Society and vote on decisions and be more actively involved. And as Jackie mentioned, they can be an employment partner. We would love to hear from people who have maybe jobs that might help our members move to the next stage in their lives. And certainly, if someone is really passionate about mental illness and would like to support people, they can give us a call. We are also an employer and always looking for, if someone is interested in working, then we don't have any job openings right now, but we'd love to hear from them and keep their resume on hand. So
that's true. Yeah, we really appreciate our donors. We would not have our doors open if it were not for donors, because we do not receive any funding from the government as yet. We have no sustainable funding. It's 100% through grants, donations, foundations, And it started with the generous support of the Sisters of St. Anne, as you know, Seema, you remember that? They gave us $500,000. That was a big boost to get us going, but it hasn't come yet, the funding from the government.
And I can certainly talk a little bit about what an amazing thing people are donating to, and how effectively and financially responsibly we use those donations. So there's a clubhouse called Pathways in Richmond that mentored us and continues to and got us up and running. And they did a social return on investment study and found that for every dollar that went into the clubhouse, there was a $14 benefit to society. And that, you know, I talked a little bit about the benefit of keeping people out of hospital, out of the criminal justice system, getting people back into employment, getting people's lives back means they're contributing members of society, and that's such a benefit. Also, we crunch the numbers, and we are able to provide mental health support from staff, that work order day, the employment supports, everything. It costs us $1,400 for an entire year of that for one member. So we have 235 members, and each of them, it's $1,400 a year just to support one member. And that's a really good bang for your buck when you think about how much services cost for mental health services. This is a really affordable and evidence-based way to help people really practically get back to wellness and get their lives back. And it's very strengths-based and very empowering. So they leave feeling a sense of accomplishment.
Well, events lined up?
We have a plan to have a art show, and that's been on hold, and then we're thinking about it again, then it goes on hold because of COVID, but we are looking at that again for the new year, early in the new year. And that's the main thing. And then of course, we're opening now full-time to our members. So that's old news now. Anything else you can think of, Margaret?
Well, we do have, we didn't really do it, the employment program justice. Paris Roca Candy, which is a local candy maker, Marion Paris was, she's quite open that she started the candy business as part of grief work because she lost her son to mental illness, and she actually hires some of our members to package her candy, and she's very generous with the proceeds from her candy, and so we benefit in that way. So we do have some chocolate orders right now that might be something that if people want to support us, we do have an order form for her chocolates, and they do come to us. I'm not sure, that might be a way. And yeah, as I said, we're building out our employment program. So I would say stay tuned or follow us on Instagram or Facebook in order to find out more about what we're getting up to. We also have a blog on our website, and I keep our website up to date as well.
Yeah, that's all it's all good, Margaret. Thank you so much for saying all what you did. I want to just add about Paris Roca chocolates. If you haven't heard about the chocolates, they are just absolutely delicious. And she supplies the Empress Hotel with chocolates to put on people's pillows at night. They turn down the pillows or the bed. And also Chateau Victoria. So they're really very professionally done in a proper professional kitchen. They're just lovely, and it's just a great experience for our members to work in that environment and to have that employment too.
Yes, definitely. Yeah. And if there's anything else you'd like to add in the end? Did we miss anything?
I think
so. I think we've covered it all. Yeah.
Yeah. Thank you, Seema.
Yeah, thank you.
Thank you so much. That was wonderful. It's great to be able to spread the news about us.
Definitely. Thank you for your time. And
thank you.
We'll talk
Have
to you
a good night.
Okay. All right. Bye-bye.
Bye.
Have a great night.
Bye.